Hello friends, welcome to a new lecture today on hydronephrosis. Hydronephrosis. What is hydronephrosis? Hydronephrosis tells that there is dilatation to the kidney. Normally, whenever there is obstruction to the urinary tract at any place, at any space, whenever there is obstruction to the urinary tract, that can cause dilatation to the kidney, causing hydronephrosis. This hydronephrosis can be divided into either unilateral or bilateral. There can be unilateral obstruction to the kidney, or there can be bilateral obstruction to the kidney. So first let us learn about the etiology of hydronephrosis. In that, let us learn about the unilateral hydronephrosis. In unilateral hydronephrosis, there is obstruction to the kidney on one side. So, it can be either extramural obstruction or intramural obstruction or intraluminal obstruction. First, let me explain about the extramural obstruction. Extramural tells that this is the ureter. So here, this is the wall of the ureter. Okay, there is something which is coming from outside and pushing the ureter wall. As a result, it is obstructing it, thus causing obstruction. So, this is how there is extramural. So, this is called extramural obstruction. Okay, extramural obstruction of the kidney. Right. So, what are the main etiological features for extramural obstruction of the kidney? Think that there is some tumor. Most commonly, tumor of either cervix or rectum. Because if you see, here there will be cervix and then here there will be rectum. Okay, there can be cervix here or there can be rectum behind. Okay, so whenever there is obstruction or tumor at this site, this can cause compression to the ureter or the bladder, thus causing mostly ureter to start with. So that can cause unilateral hydronephrosis. That is one. Whenever there is fibrosis, that too retroperitoneal fibrosis. There is retroperitoneal fibrosis. That fibrosis can even compress because fibrosis, whenever the fibrosis contracts, even along with the fibrosis, the ureter also gets compressed. So that is one more thing, which is retroperitoneal fibrosis. One more thing is whenever there is retrocaval IVC. The IVC is present behind the ureter. So, if this is the ureter in cross section, if you have to see, if this is the ureter and this is the IVC, because this IVC can compress the ureter. This IVC can exert a compressing pressure on the ureter, thus causing unilateral hydronephrosis. So, these are the main features of extramural hydronephrosis, where there can be tumor, there can be fibrosis, retroperitoneal fibrosis, or there can be intracaval inferior vena cava, retrocaval inferior vena cava. So, these are extramural causes of unilateral hydronephrosis. What are the intramural causes? Now, intramural is something in the wall. There is something in the wall which is causing the fibrosis. That is intramural obstruction. So, what are they? One, it can be a neoplasm in the ureter. In the ureter, there can be neoplasm, and this neoplasm may grow and this can obstruct. That is one. And sometimes there can be even strictures of the ureter. Okay, there can be a tumor which is obstructing the lumen, or there can be strictures, ureteric stricture or ureteric stenosis. Two more important things which are important is the presence of ureterocele. There can be ureterocele dilatation here, and this ureterocele at the end has a narrowed orifice. In ureterocele is, because of narrowed orifice, there is formation of stasis of urine here. So this ureterocele can also be an intramural obstruction. And one more thing is congenital pelviureteric obstruction. Whenever there is congenital pelvi, this is the pelvis, this is the ureter, whenever there is congenital pelviureteric obstruction. So these are the different causes of intramural obstruction. Then what about the other type? This is intramural. Then there is one more type which is called as intraluminal. That is in the lumen. intraluminal. It is in the lumen. So whenever there is a stone in the lumen, so this can also cause intraluminal obstruction, most commonly stone in the renal pelvis. These are the unilateral causes of ureteric of hydronephrosis. Then what about the bilateral causes now? Bilaterally, the bilateral causes are most commonly from the bladder. It starts from the bladder and ends till the ureter. So, whenever there is ureteric atresia or ureteric stenosis, so that is the main bilateral cause. And sometimes there is also benign prostatic hypertrophy. There is prostate here. Sometimes there can be benign prostatic hypertrophy or carcinoma of prostate, thus causing obstruction here. That is one more. And sometimes there can be bladder carcinoma. So there can be carcinoma in the bladder which grows and which can obstruct the bladder outflow, thus causing hydronephrosis. And so these are the different causes of hydronephrosis. I'll just show you in the diagrams which I have drawn and also labeled. So this is my notes. So if you wanted to see the unilateral hydronephrosis, it can be extramural obstruction where there can be tumor. This is the tumor. Or there can be retroperitoneal fibrosis, or there can be retrocaval ureter or aberrant renal vessels. If there is intramural obstruction, it can be congenital pelvic ureteric obstruction, or it can be neoplasm of ureter or ureteric stricture, or congenital stenosis or ureterocele because of narrowed ureteric orifice. So these can be seen. And if it is intraluminal, there can be stone in the ureter or pelvis and sloughed papillae in the papillary necrosis. Then if it's bilateral hydronephrosis, it can be congenital posterior urethral valve or urethral atresia. If it's acquired causes can be postoperative bladder neck scarring, bladder carcinoma, benign prostatic hyperplasia, prostatic carcinoma, carcinoma cervix, inflammatory or traumatic ureteric stricture. So all these are the different etiological features which are responsible for hydronephrosis. Thank you guys for watching my lecture. In my next class, I will explain about the other features of hydronephrosis. Thank you for watching my lecture. Thank you.